Hey y'all, so I'm going to talk about antihistamines in this video, but first I want to touch on allergies for a quick moment. So an allergy it's an excessive reaction that leads to an inflammatory response when one is encountered by an allergen, okay, or a substance that they're sensitive to, okay. When one has hypersensitivities, this is when the immune system overreacts altogether, okay? Your immune system ultimately is your protection, okay? Your protection in the body. It protects the body from living substances that can cause infections, such as bacteria, viruses, fungi, okay? Which are your antigens that can enter the body and cause a whole lot of problems, okay? You also have lymphocytes. Okay, lymphocytes make 5 of your antibodies, okay, or immunoglobulins for protection. You have IgA, IgD, IgE, IgG, IgM, okay, and your IgE class of antibody is the body's defense against allergens, okay. So I want to touch on that first. Now we can get into antihistamines, okay. You have 2 different types of histamine. Okay, you have histamine 1 receptor antagonist, you have histamine 2 receptor antagonist. We talked a lot about histamine 2 antagonist and those medications when we talked about GI meds, okay? This one, we're more going to talk about your H1s, okay? Dealing with the histamine 1 receptor. Okay, first generation, second generation drugs are further divided into 6 main groups, and the whole action of your antihistamine is on the H1 receptor, okay, which blocks the histamine from releasing small blood, from the release into small blood vessels, your capillaries and nerves during an allergic reaction, okay. The medications, when you take an antihistamine, it's going to relieve the itchiness, relieve the sneezing, relieve the rhinorrhea, okay? But it doesn't really relieve the nasal congestion, okay? You have first generation antihistamines. They can also produce cholinergic effects and drowsiness, all right? So just to get a better understanding, histamine is released by your mast cells and basophils when the body is injured. Okay, histamine dilates the capillaries of the smooth muscle in your vascular system. Okay, and then antihistamines relieve the effects of the histamine on the body's organs and the structures. Okay, so the uses for these: seasonal allergic rhinitis. Okay, allergic disorders, anaphylaxis, sedation, insomnia, and even some motion sickness, believe it or not. So I mentioned like that first generation, second generation. You have first generation antihistamines, which is your diphenhydramine, which should sound familiar, your Benadryl. You also have brompheniramine, which is your Dimetapp. You have promethazine, dimenhydrinate. Those are all first generations, okay? You have second generation, which is loratadine, which is your good old Claritin, cetirizine, which is Zyrtec, fexofenadine, which is your Allegra. Those are your most common, okay? You also have some intranasal antihistamines, which is your azolastine and your olopatadine, if I'm saying that correctly, okay? Some side effects of this could be constipation, blurry vision, dry mouth, urinary retention, and then dried, thickened secretions, okay? Complications could be some sedation, some anticholinergic effects. The anticholinergic effects would be the dry mouth and the constipation, even some GI discomfort, some nausea, vomiting, and then the more more severe, there we go, I was looking for the word, more severe complications would be like acute toxicity, hallucinations, seizures, especially in children, okay? So don't give it to small children unless directed by a doctor, okay? Respiratory depression even, okay? Okay, lifespan considerations. That brings me to what I just mentioned about children. For pediatrics, infants and young children often have anticholinergic and adverse effects when given antihistamines. Okay, paradoxical reactions may occur, which are like an increased nervousness and a confusion and even a hyper excitability. Okay, and then even for your elderly patients, our aging adult, we always want to consider them as well. They are more susceptible to side effects for these medications. Okay, dizziness, syncope, confusion. Okay, so you want to be very considerate and take into consideration for our pediatric and our aging adults. Okay, and that's pretty much the gist of antihistamines.